Good morning, everyone, and welcome to the IPS webinar, Creating Healthy Communities Through Culture Appreciation. We're really excited to join you today and stimulate a discussion about how to include culture and traditions of the community members we serve in our prevention strategies in public health. With that said, let me introduce our wonderful team today first. So we'll go on to the next slide. And you'll see some awesome names on there, including mine. My name's Breny Aceituno. My pronouns are she, her, ella. And I'm the program director of the South Bay and Border Community Programs at the Institute for Public Strategies. And I'll let Iridian and Flor introduce themselves, starting with Iridian.
Hello, everyone. Thank you for joining us. My name is Iridian Vazquez. My pronouns are she, her, ella, and I am the community organizer with IPS at Partnership for Success program.
Good morning, everyone. My name is Flor Hernandez. I'm the prevention specialist for the Partnerships for Success program here at the Institute for Public Strategies. Thank you for joining us.
Next slide, please. Thank you. So the three of us run the Partnerships for Success program, also known as the P4S program, which is a SAMHSA-funded program. And the program was tasked to prevent the onset and reduce the progression of substance misuse in the South region of San Diego, specifically among the Latino population. The program is also responsible for strengthening the capacity and the infrastructure at the community level and to address the behavioral health disparities among the Latino communities. In a nutshell, our program goals are to prevent opioid misuse, meth use, underage drinking, and to increase the prevention infrastructure in these communities. Next slide, please. Knowing that, today we're here to talk about how cultural organizing emerged as a multidisciplinary practice within our program and how we intersect our cultural work and social change to achieve P4S's program goals. Our team has certainly championed this strategy in our work with the Partnerships for Success program at the Institute for Public Strategies. And we would like to show you how we did that so that you can see how you can use some of these strategies in your own work. I want to start off by saying that this is very much a tailored approach that is meant to generate knowledge and understanding among community members, as well as among public health professionals, by placing a real emphasis on listening and storytelling. We at IPS are advocates of systems change, and one of the main reasons we took this approach is because we noticed that some of the public health models, while well-intentioned, we're kind of missing the mark when it comes to advocating for public health in a way that was relatable to our communities. That is why we took it upon ourselves to integrate local cultural practices, forms of expression, and worldviews into our organizing model. This really allowed us to be recognized by community members and community partners, which ultimately also allowed us to build a solid foundation of trust and visibility that didn't really exist for us before. Perhaps most importantly, this strategy has allowed us to remove the barriers to social cohesion and to actually reach our goal of achieving a long-term community health. And this is also how we achieve a long-term community transformation. Next slide, please. So here are the essential steps to culture organizing as we have used it. As I mentioned, this is very much a fluid model that can and should be adapted to your community's needs. So first, what we did is considered our program's goal, and we did this with a comprehensive needs assessment to learn everything we could about the risk factors and protective factors that exist in our focus communities. This is a really great step that we highly recommend you take with your program. And I want to emphasize that we should all be approaching this step as if we know absolutely nothing about the community. And that's even if you yourself are part of the community. Coming to this step as a student is key to truly having your program's work respond to the community's needs. And we'll talk a little bit more about that first step in just a moment. Second, we brought in culture, language, and traditions into our work. This allowed us to create tailored approaches that our community recognized and responded to. Town halls, as you know them, as they sometimes work today, they don't really talk about the resiliency of the community. They really just focus on the issues. And this is a problem. And community members also recognize this as a problem. So we recommend addressing that problem by instilling the culture of the community into your program work. That way you're discussing the issues with the community while at the same time showcasing the community's resiliency, which breeds empowerment. And thirdly, we constantly look at ways to connect the community with that greater understanding of how social cohesion fosters community health. This is how we get community to see the larger goal, which is ensuring that everyone has or should have the opportunity to thrive in their communities, no matter where they live. Next slide, please. So let's get into it. What does it mean to actually consider your program's goal and do that comprehensive needs assessment? Like I mentioned, this step is really about setting your assumptions aside and absorbing what data and what community members tell us about their community. So that means we're looking at things like census tracts, and we're also looking at lived experiences. Next slide, please. Before we got into that learning phase, and before you get into that learning phase, you should definitely take a good look at that big picture that you and your organization are trying to accomplish with the program. So here's what that looked like for us. The P4S program, led by the Institute for Public Strategies, is committed to working alongside communities to improve community health. The P4S program works to empower community members to increase access to opportunities and combat risk factors that lead to substance misuse among the Latina community members. We do our work at IPS through our ACT model, which aims to achieve community transformation. And as you can see on the slide, our ACT model is not linear. Instead, we can jump back and forth, up and down, side to side, to really hit all of those five components that together achieve community transformation. Those components are community organizing, data and research, policy and systems change, media advocacy, and sustainability. This means we're constantly thinking about how we can use these five components in our work to transform a community. And at the same time, we're using these elements to really foment the community's resiliency. Next slide, please. So now that we know what that big picture looked for us at IPS, and specifically with the P4S program, let's get back to our steps for culture organizing. We know that we needed to approach our community with zero assumptions. So we became a student of the communities we serve. This means we looked at the components of the communities from quantitative lens and from a qualitative lens. And I want to emphasize that both are really essential. Hard data or quantitative data does tell one picture, as you can see from the map on the slide. But we do need more than just that. We need to hear from community members and record their experiences in this process. Here's how we did that. So for the quantitative component, we looked at our 4 indices to do that needs assessment. So we looked at the Childhood Opportunity Index, we looked at the Intercity Hardship Index, the Healthy Places Index, and the Neighborhood Conditions Index. And then we layered that with our census tracts in the region so that we can see how risk and protective factors are playing out specifically for the Latina population. That investigation gave us this map, which allowed us to see what areas in the South region are dealing with the most disparities. As you can see from the map, the region is pretty large, and our team is just 3. So this is actually also a very practical approach, because now we can justify to our program funders where we're going to be concentrating our efforts. The hard data tells us that the communities that are most impacted with negative community conditions are, at least in our region, the southern part of city of San Diego, which are the communities of San Isidro, Nestor, and Otay Mesa, the west side of Chula Vista, National City as a whole, and the eastern part of Imperial Beach. While we were gathering the hard data, our team was also doing listening sessions and interviews with community members and community leaders to better understand the context of that hard data. So in those interviews, we heard overall that people felt there was a historical underinvestment in the region. that trust in systems has declined to critical levels among the Latino population, that the proximity of the border facilitates underage drinking and a general accessibility to drugs, that poverty and low status jobs and the complexity of public health benefits are barriers to Latinos accessing healthcare. And lastly, that there is a cultural stigma related to mental health and substance use that exists among many Latinos in the region. Next slide, please. It was extremely important for us to do these interviews with community members because it really allowed us to better understand the story of the South region. And we're not the only ones who know this to be true. There are plenty of studies out there. One of the ones I'm citing here is from the University of Oregon that show how important it is to get data straight from community members. More importantly, this is a great example of how we can start empowering community members to use their voice for their communities at the very beginning stage of the program. And ultimately, this demonstrates that that community members are the experts in their communities and they should be treated as such. Next slide, please. And just to give you a bit of an idea of what community members were saying about their communities in the South region, here are a couple of quotes I pulled out that were significant for us to really understand. So the first one community member said, quote, "Policies in public health and public benefit programs make accessibility very difficult. These programs have barriers within their systems and processes that make it almost impossible for people to access the programs when they need them. We Latinos have cultural barriers, and those can range from language barriers that exist to different cultural approach to health." Another community member said, quote, "Lack of healthy spaces is at the heart of the Latino population's health challenges. For example, lack of green space and walkable neighborhoods deters a lot of our residents from riding a bike or walking around their neighborhood." And lastly, another Latino community member said, "In our Latino community, it is taboo to let others know that we have an addiction. It can be alcohol, it can be drug abuse. I can tell you by my personal experience with my family members of mine, my parents feeling very embarrassed to share the fact that we need a support with a brother or whoever in the family. So that's something that really prevents families from seeking out help." I also want to mention that a lot of these interviews did take place in Spanish, and many of these quotes were translated from Spanish to English. Next slide, please. With that, the last thing I want to mention about step one is that effective communication is paramount in public health advocacy, and linguistic accessibility plays a pivotal role in reaching diverse communities. Public health advocates must be able to communicate in the languages spoken by community members to ensure that vital health information is clearly understood. As I'm sure you all know, language barriers can and do impede the dissemination of critical information, which hinders the adoption of preventative measures and healthcare practices. Additionally, cultural competence is equally vital. Understanding and relating to the cultural nuances of a community fosters trust and facilitates a more profound connection between advocates and community members. This cultural competence not only enhances the effectiveness of health messaging, but also stimulates innovation in the development of prevention strategies. By incorporating cultural traditions and values into public health initiatives, advocates can create interventions that resonate with the community, making them more likely to be embraced and sustained over time. If you all remember, sustainability is a component of our ACT model. And it was this feature in our ACT model that made us, the P4S program team, realize that we really need to include cultural organizing into our work if we want to achieve a sustainable impact. This approach not only respects the diversity of the communities, but it also acknowledges the influence that culture has in shaping health behaviors. In fact, if you can take anything away from step one, I want you to take this away. Culture shapes health behaviors. And this means that ultimately the ability to communicate in the community's language and relate to its culture empowers public health advocates like us, like you, to develop a more impactful and sustainable strategy for prevention and health promotion. With that, I will pass it on to Iridian so she can get us through step 2 of culture organizing.
Thank you, Breny. Hello, everyone. And for step 2, we have 2 case study examples we will walk you through on how we brought culture, language, and traditions into the work. In doing so, we must be mindful and create tailored outreaching materials and events that your community will recognize and respond to. Next slide. So how does that look like? So in order to integrate culture into prevention goals, each study case illustrates how to destigmatize talking about community conditions, connect community members to advocacy, and lastly, how to connect community members with individual-based services. For case study 1, we will focus on cultural integration with Dia de los Muertos. It's also known as El Día de Todos los Santos. This is an indigenous tradition to honor our loved ones who have passed by celebrating the cycle of life. This tradition is celebrated among the Latina population with various backgrounds. And the intention behind setting up altares throughout the South Bay was to acknowledge and make space for the lives lost due to COVID-19. Empty picture frames were made available for community members to add their pictures as a way for them to engage with the altares. This was the only way to hold space for community while social distancing to ensure everyone's well-being. Thank you. All right, so let's step back into 2021. That was the first year the team hosted altares throughout South Bay communities. And in efforts to bring the community together, our goal was to destigmatize grief, loss, and hold conversation around mental health. The altar and social media served as a tool to also bring awareness on how the pandemic disproportionately affected the Latina community in the South Bay. We were also able to connect community members to resources such as COVID testing, nearby clinics that offered free testing and vaccines. The article featured on the slide is from Voice of San Diego. It explains how people of color are more likely to experience lower quality health care and have less access to resources. Studies also suggest that this can result in stress, which then raises the risk of emotional and physical health problems, including depression, cardiovascular disease, hypertension, and even death. With this article, we found that COVID-19 brought forward many existing and new issues facing communities of color. For example, we found that the South Bay is more susceptible to the virus because of the conditions of its communities. Due to the border proximity and high concentration of the industry, many residents are more likely to have a chronic illness such as asthma, diabetes, or a heart condition because of the combination of bad air quality and limited green space. Next slide, thank you. So as we move throughout the years, we address additional community concerns such as substance misuse, and many of our community partners are also sending us free direct resources they offer, such as TB testing, food waste education, and local community clinics to share on the altares. And in addition, the P4S team also provides free English and Spanish Narcan trainings, which was made available on the altares. So let's take a look at the slide for a second. And you can notice a change in our partnerships throughout the years. And you can also tell we had a consistent partnership with the libraries. We found that libraries are a trusted source. They connect us with the community, after-school programs, and this component made them an ideal partner for the altares to reach the community. So who are those trusted partners you've cultivated throughout the years? What would they be able to host their space for a collaborative event? This is something to keep in mind. Let's also take a look at the Otay Valley Regional Park Partnership as an example. We hosted the cultural component with them in 2022, where we invited youth and community members to plant milkweed in efforts to create a migrating path for monarch butterflies. This past year, with the help of their new intern, they were able to organize an outreach on their own. There was support and ownership on both ends, which is a great progress because we want our partnerships and other community-based organizations to take on these practices and projects themselves so the communities they directly serve hold ownership. Imperial Beach is another example. The city of Imperial Beach officially took on hosting this cultural event yearly. And if you take a look on 2021, we partnered with the Chula Vista Library. However, after that year, they took on full leadership and developed their own altares. We also continued a partnership with Lincoln Acres Library in National City, Casa Familiar in San Isidro, and made new partnerships throughout the years, such as Olivewood Gardens Learning Center, which is also located in National City. And next slide, please. In some occasions, we were in direct contact with community members, and that is where we were able to introduce and invite them to our advocacy efforts. This was done so by sharing our Instagram page and flyers of our coalition team that included a description and a QR code for them to sign up. Again, the flyers need to be in English and Spanish because they serve as an outreaching tool to access both communities. And next slide, please. So as we gradually grow, community response and engagement have been improving. It's important to keep in mind that the P4S program is focused on serving the Latinx community. Therefore, our team is bilingual and our outreach material are in both English and Spanish to connect and serve the bilingual and monolingual Spanish-speaking communities effectively. So for example, this quote from an Imperial Beach community member, she shares about what she thinks about seeing the city of Imperial Beach hosting Dia de los Muertos. And she says, well, the majority of the community is Latina, and it is good for children to learn about their roots, right? That is important, and let the adults maintain it, and also for coexistence. It is very important. And I also agree. This was actually translated from Spanish, and with this quote, we can see how community recognizes these traditions. Next slide, please. So lastly, how are we able to accomplish all this? We submitted an application for the Vaccinate All 58 grant to address COVID-19 within the altares. And our approach was to address it through our flyers, our social media posts, along with printed materials. The funds were used to purchase altar supplies such as flowers, tablecloths, calaveras, and as mentioned, printed materials. Oh, and we can't leave out the delicious hot chocolate and pan dulce. It's a crowd favorite for sure. It also incentivizes the community to show up. And special thank you to Clementina Sweets, a local Latina-owned business. So in addition, this is also an example as to why it's important to build and hone community partnerships with your surrounding community. We learned about this grant via Molina Healthcare. So big shout out to Ana Lozano, who is part of our advocacy efforts as a coalition member. Her and many more coalition members have championed our efforts on our behalf, and we truly appreciate their ongoing support. So can you identify those partners in your community? How can you further evolve those partnerships to the next level? And with that, I will pass it on to Flor to walk you through the second case study.
Thank you, Iridian. So for the second case study, I will be discussing the community posada that we held last year in 2022. This is an overview of all the different components that go into a community event. So I'll be walking you through addressing culture, community partnerships, securing funding and addressing COVID, community outreach, as well as advocacy. These, again, are some things that you can consider in your organization when you create a community event. Next slide. So addressing cultural traditions. This is a key way to be able to connect with the community that we work alongside. Posadas are a Catholic celebration to commemorate Joseph and Mary's journey to Nazareth for the birth of Jesus. And while there is a religious aspect to this, there's also a sense of social gathering. This is an opportunity, or we saw it as an opportunity for community members to gather and engage with each other to promote mental well-being. In addition, these spaces can create a sense of vulnerability where community members can offer each other support and have conversations on what they see is happening in their community. By embracing familiar aspects of culture, the community has more buy-in with the program and more trust with us, the staff. And so we chose the community posada very intentionally because we knew that by integrating these aspects that people would come. And so for your program, when you're thinking about how to integrate this into your specific organization or program, again, choose cultural traditions that speak to your community and try to apply it as authentically as possible. And so that's why we're very specific. Cultural foods were available, such as tamales and ponche, and we also had a piñata for the kiddos. Next slide. And so again, looking at community partnerships for this specific event, we partnered with Olivewood Gardens and Learning Center in National City. And so when you're thinking about who to create or who to collaborate with, it's important to try to make partnerships with the community-based organizations that have already been doing this work and have been recognized by the community. And so in doing so, you can, again, establish that sense of trust as well as support each other's work. And so Olivewood Gardens has been a great community partner with us. And so that way we aren't trying to recreate things that already exist, but we're enhancing certain community within these spaces. And so again, they're a great partner of ours. They have a variety of different programs, such as Cooking for Salud. They have high school internship programs. They host the Healthy Culturas Coalition on a monthly basis. They work in school gardens, and they also have a donation-based produce stand. And so the Cooking for Salud program specifically has a kitchenista program, or that is also what it's known as. And so these kitchenistas are community advocates to teach people about healthy foods and food sovereignty. And so in partnering with them and being able to use their physical space for this event, we were again able to connect with the community that they already have, as well as connect other outside community members to that space for the first time. Next slide. So to secure funding for this event, Iridian mentioned that we use the Vaccinate All 58. Half of that grant went towards buying the supplies for the Dia de los Muertos altares. However, we still had some left over, which again, we applied to this specific community event. And that specific grant, again, was for COVID vaccination efforts as well as COVID education. And so to integrate that public health lens, we reached out to our partners from San Ysidro Health. Through them, we were able to provide free COVID tests, sanitizers, and masks for everyone. This also came with a tote bag that, again, had more information on their specific services, therefore connecting them to San Ysidro Health and all of the great things that they do. If you were to do something similar, I would suggest to connect to those local health providers that can provide free resources. And so the grant funds were not only used to cover the physical space, but also pay for a cooking class, where 10 community members learned how to make tamales directly from the kitchenistas using all of the delicious things that have been grown in their garden. So yes, next slide. The outreach component for this specific event, we used a variety of several networks, such as the Olivewood Kitchenista Network, our own social media channels. We also blasted this through our P4S Coalition, and we also inserted this flyer into our partner newsletters. And so to be able to again, authentically reach the people that we are serving. All of our materials, again, were created in both English and Spanish. And we included several key components in the flyer, such as like master and courage, to dress warm. And we also regularly make it known that all of our events are free and that translation is available when needed. And so these are things that as you are working with your community to consider, because there's certain like key phrases that they might respond to, and again, add to that accessibility to be able to authentically connect to your community. And as already mentioned, again, all of our staff is bilingual. And so we are able to communicate with monolingual Spanish speakers, making them more comfortable and establishing that trust. Next slide. This event was also a soft introduction to advocacy, while there are the more conventional community resource fairs or town halls addressing substance misuse like directly. We wanted to use this as an entry point so that they could learn about our coalition and also what we do in the community. And so we were able to do that as well as introduce them to the advocacy that we are working towards building up. And so each community member took this survey that we had at the time, which was a park equity survey. They gave us their thoughts and feedback on the conditions that they're experiencing in their local parks. And so again, that was an entry point for them to be able to, one, tell us what they see in their community, and two, give us ideas on what they think the solutions can be. And so in addition to that soft approach, we also, again, introduced some community members directly to the Kitchenista program and Olivewood Gardens to, again, continue that sense of like self-advocacy and empower them to be able to address their own problems. Next slide. And so the step 3 is to be able to connect the community with an understanding of how social cohesion fosters community health. Next slide. And so why are we even talking about cultural organizing at all as a tool for public health? And so in the social determinants of health, social and community context is a component of these. And so when people feel a sense of belonging, they are more likely to develop healthier coping mechanisms for when those unknown life circumstances happen, therefore deterring them from substance use. And so we're going to talk about 4 points: promoting inclusivity to strengthen social networks, community engagement programs, empowerment through collective action, and communication platforms. So next slide. And so specifically touching on promoting inclusivity to strengthen social networks, we try to create spaces that welcome diverse populations. In doing so, we can get authentic collaboration and interaction among people from different backgrounds, therefore creating those social networks that promote mental and emotional well-being and fostering that sense of belonging. Through our South Bay Summer Festival, which is an annual community resource fair that we host, we were able to bring together people that might have never really crossed paths before. And so we're really proud to be able to create those moments where people do form those connections and can thrive and can work, see how they can, you know, bring their efforts together and create an even healthier region. Next slide. In addition to the soft approach of integrating culture or hosting cultural events, we also host a regular calendar of events throughout the year, such as community forums at our town halls, because we do the more conventional town halls. But even when we are doing the more conventional prevention events, we always integrate those same aspects of culture. And so whether that be Spanish translation being available, or cultural foods being offered, or reaching out to established trusted community experts to speak on certain topics, to be able to guide them through those more difficult conversations. We're always trying to be as inclusive as possible, to be able to connect to community in an authentic way, and not only do the more fun events, but also, again, be building up the capacity for them to take on their own initiatives, which leads me into the next slide. And so we have worked with an array of different community members to be able to address common health challenges. And so our whole entire goal is to be able to build capacity within community members so that they can advocate for themselves. Our grant cycle, we are on our first grant cycle with SAMHSA. And so although the hope is to get renewed, we don't have that as a certainty. And so we want to be able to build people to not rely on us and to not need us, but instead to feel that own self of empowerment, to be able to, again, address the problems that they see in their community. Next slide. And lastly, that connecting with them through different channels, such as our social media channels. But we also have a monthly curated newsletter that goes out. And through this newsletter, we are able to encourage community members to also share their stories or connect them with other resources and service providers that can meet their needs. And so that is always something that we're thinking about, to be able to connect and outreach effectively. Next slide. So with any program, you face challenges and successes. And so these are some of the challenges and successes that we have come across so far. And so securing funding is always a challenge. Again, I mentioned our grant is through SAMHSA. And so one of the limitations of that grant is that we're not able to purchase food at all. And we know that food is a really important thing for community members, and it is really what brings them to us, and it creates a sense of accessibility, and it acknowledges the challenges of the region. And so we're always constantly looking for ways to cover food, because we know that it's an essential part of the work that we do. We also host a lot of events collaboratively. And so sometimes we have miscommunication between partners of like expectations that weren't shared, or things of that, things of that nature. And so it can be a challenge, but it also challenges our program staff to think out of the box and adapt and become flexible for when we know that those mistakes are coming, because we are not perfect either. And so something that I listed as both a challenge and a success is engaging with community members. Again, using the altares as an example, we encourage people to put up a picture of their loved one on our community altares, but that may not always happen, as that can be an incredibly private thing, and that is okay. We are always trying to be able to make community feel comfortable with us, which is why we address culture to begin with. And so when people do engage with us and they do come to us and they understand that they can trust us with the different challenges that they're facing, it's incredibly rewarding, and that is a success. And lastly, as a challenge, it's a challenge for us to find spaces that are open to cultural events. Our main office is located in Mission Valley, and if you're familiar with the San Diego region, that's more in the central region, and we serve the south and border region. And so although we do have a small office in Imperial Beach, it is not nearly big enough to cater to the size of our events. And so we always have to be creating partnerships with the different service providers in the region to be able to get those physical spaces. And so that has led to a success as well. Even though it is a challenge to find spaces, we have created those strong partnerships to be able to know that, oh, when we're hosting like XYZ, we can ask, like, we already have a list of like partners that have been incredibly open to the work that we do. And lastly, a success, I see these as one is cultural visibility and cultural appreciation. We, again, try to show community that they belong here and that their traditions and that their culture deserves that mainstream attention. And so it's been incredibly rewarding to see them also feel really proud of their cultural background and also learn to re-engage with certain aspects of culture that they might have lost through migration or through the generations. And so it's incredibly rewarding to have those moments when people are genuinely thankful to see their culture being displayed. So yes, that are some of our challenges and successes. Next slide. And so that brings us to the end of the presentation. Our contact information is listed here, so feel free to reach out to us if you have any questions on more specifically how this can be applied to your organization or program. We've been learning a lot through this grant cycle, and so we're always open to sharing what we have learned and what, yeah, our suggestions can be. So thank you all.
Thank you so much, Breny, Flor, and Iridian. That was a beautiful presentation. So we do have about 17 minutes for Q&A. If you have questions, I encourage you to go ahead and drop them into the Q&A box so that they're not lost in the chat, although I am keeping an eye on the chat just in case. Before we get into that, though, we do ask folks to take a minute or two to fill out our webinar evaluation. This helps us to plan for future webinars. We take all of your feedback into consideration. And so there's a QR code on the screen. If you're able to, you can use your phones to scan it. I'm also dropping the link in the chat for you. And for all wondering, I did mention earlier that we are recording today's webinar, and so a link to the recording, the slide deck, will be emailed out to attendees by the end of today. And I also just want to note that IPS does offer training and technical assistance for all of our core competencies. And so if you are interested in learning more, you can reach out to us at info@publicstrategies.org or any of the presenters' emails or my email. All of those will get to the right person, I can assure you.
So now we will jump into the Q&A, and feel free to drop in questions as you go, and I'll just go ahead and read. So as you guys are creating outreach material, do you recommend flyers to be front and back, one-sided? What's kind of a best practice for your team?
I can take that one. We've played around with a lot of this, so we prefer not spending, saving paper. So if we can have it all on one slide, on one flyer, that's awesome. A lot of the times it does get too text heavy, so we need to create two different flyers, and what we do is just print them front and back, and so that way we're just giving one flyer to the community member. They can choose which side to flip to see which to get the information that they need from that flyer.
Thank you, Breny. This goes a little bit more into, I guess, translation services. So I know you guys mentioned that you guys are all bilingual, and that's really important. But can you tell us a little bit more about if maybe a program doesn't have a native speaker on staff, or maybe someone who's not, the best at the other language, maybe knows a little bit? How would you approach that?
I'll let Flor address that one.
Yeah. So we understand that bilinguals is difficult sometimes. I think even for us who are all bilingual, we all have those challenges. But I think one is really important to hire a translator if that is possible. Specifically for community events, we know that adds a sense of being able to, just feel welcomed in the space, specifically for monolingual Spanish speakers, speaking about us specifically. But if you can't do that, then it just has to be an ongoing conversation with your organization or program of how you can meet that need ultimately, because we know that it is really important, right? There are also translation services offered, through Google. That's not the best way, but if there is no other way, that can be a way to meet that bilingual need. But I don't know if any of the team has any other suggestions.
Yeah, I can add a little bit more. It's definitely to keep that conversation open within your agency. It's really important to be able, as I mentioned with step one, to be able to communicate with community members. There is a lot of information out there that sometimes doesn't reach community, and a lot of the times it is that language barrier that becomes the central issue to that. But we also have plenty of staff that don't speak the language, like Spanish, for example, or the Latino population is also so diverse linguistically, as in some folks are Latinos, but they're only English speakers. And so being able to find a team that supports that, so that means that we have team members in this team, for example, all of us being bilingual, but we have another program that we work closely with, or not everyone is able to speak Spanish. And that just means that we just have to make sure that when we're doing an event together, we're finding ways to meet the needs of community members. If that's internally, that's great. If we need to hire someone from outside to help us translate, that's what we'll do. And the other thing that we emphasize a lot, as you might have seen with the image that Flor shared in her slide, we have a monthly newsletter, and that newsletter is in both Spanish and in English, and the Spanish is the first thing that you see. And so what we do when we send out emails to our partners, letting them know that we're about to send a newsletter, send us any information that you want us to include in that newsletter, we always emphasize that if we're going to plug in any flyers, we want to be able to plug them in both Spanish and English. And so we're constantly using our voice to let our other partners know that this information can not only be available in English, it has to also be available in Spanish or in the language that your community speaks, right? There's a lot of Tagalog, Filipino community members in National City that speak Tagalog. There's a lot of community members in the eastern part of San Diego that speak Arabic. And so being able to identify that and then challenge your partners as well to meet those needs is really important.
Thank you, Breny and Flor. We have a couple of questions about like community engagement. The first one being if there was an incentive for community members to participate in your focus groups, listening sessions. Is that something you guys provide?
I can answer. For most of the listening sessions, there was an incentive for community members. These listening sessions could be around an hour or more. So we do value our community members' time, and this was something that um, is brought up with like the executive team, and we're like, we want to provide this incentive for community members. And I feel like that's something internally that you can talk about with your team as well. And for youth also, it's like community service or just gift cards. And also for the listening, going back to the listening sessions, we would give out some either Northgate or Amazon gift cards as well. But yes, we always try to have those kinds of incentives available for community members. And as I mentioned, food also served as an incentive, making sure that some of the listening sessions were like around 5, 6, so make sure a light dinner was provided.
Thank you, Iridian. I think one thing I have definitely appreciated about the P4S team is that you guys don't assume what gift cards community members want and will allow them to pick from different supermarkets or Amazon or Walmart, whatever is more convenient and of need to them. So I appreciate that about your guys' team. When it comes to food, so I think we established that we know you guys are SAMHSA funded. And so when it comes to food for other events that maybe you're not able to find funding for, do you rely on partners to provide food for those events? And how do you like make that ask to them?
Breny, can I take this? Okay, cool. So sometimes we make it very clear that we want to provide food at everything. And so when we are working collaboratively with partners, we do ask them if that is possible. Sometimes, again, their funding also does not make it possible. One of our biggest undertakings, I mentioned it briefly, but it's the South Bay Summer Festival. This past year, we had attendance of around 300 community members at that event, and we provided a meal for every single person. And the way that we were able to do that was one, reach out through that network of partners that we built to be able to be like, we want to supply food. And if you know anyone who can do that for free, great, connect us with them. We know that that is not always a possibility. So we also put together a funding package, a sponsorship package outside of, to be able to, raise those funds to be able to cover the cost of food, especially because we know it is so pricey. And so also when we're looking for vendors, we try to connect with people that understand that we can't be paying like $20 a plate for food, right? And so we try to make those partnerships where the food vendor also understands what we're trying to do and will give us a good price for the food that we're purchasing from them. But those are the two suggestions: community partnerships, and then if it's a more large scale thing, we do put together a sponsorship package to be able to purchase food.
Thank you, Flor. So speaking a little bit more to those partnerships, do you guys have a secret Like, what's the secret sauce, your secret to success with building those partnerships that seem to be very beneficial and last long term?
We talk about this a lot, and it ultimately comes down to showing up for them as well, right? So if they have something going on and they ask us for support, we try to be there. We try to make sure that they can count on us just like we can count on them. And so it's a very reciprocal sort of relationship where we just try to be present with our partners and show up and call them or show up to their events, table at their events, just like we ask them to table at our events. And so it's really just about being genuine with that partnership and showing up for them just as much as you ask them to show up for you.
Thank you, Breny. I'm going into a little. Oh, go ahead, Iridian. No, go for it.
I wanted to add something more to that. That constant communication is very important. Throughout like the past years, everything has been virtual. So we try to be more intentional, and when the time is given, we create space to bring all the partners together in person. For example, with the South Bay Summer Festival planning, we had an in-person meeting with all of the partners who are tabling at the event, and everybody got to meet each other in person. Many had never met in person, but they were seeing each other through the screen. So that would also be something to suggest, to have those in-person meetings too. Once in a while. I know it's not always like the best approach, but uh, just keeping that in mind as well.
Speaking of in-person gatherings, the P4S team is having their holiday get-together with their coalition members this evening. So I think celebrating the partnerships is also key in that. One thing, talking a little bit more about the community members that stay engaged in the work that you guys are doing. How do you keep them engaged? How do you keep them in the loop? What does that look like for continued engagement from community members?
I think that being able to, again, because we're a new program, we always have to be out in the community where people can like see our face. And I think that goes a long way. And so I think keeping people engaged comes down to meeting their needs, whether it be like, again, integrating those aspects of culture so they trust you. And it comes down to showing up time and time again. And so it can be tedious to like go sometimes to the late community meetings or to go to XYZ event, but it really does show them that you are trying to be a part of their community as well. And so keeping them engaged comes down to just establishing that sense of trust. And so we have a lot of people that we've engaged with. Actually, one community, this is more of a community partner, but she brings along like her whole crew wherever she goes. And she's a promotora, but one of the ways that she like engages with people is directly through phone calls. Like we can't really like, she's not going to respond to our emails or anything like that. But like if we give her a phone call, like she'll respond. And so really, yeah, it comes down to like trying to figure out what works for them and what feels right, and establishing that trust and establishing that like I'm gonna be here, like I'm not going anywhere, whatever you need, I'm like a phone call or an email away. So
I have a community member example for that engagement. The first time that they came, it was a mother and a daughter. They came to the milkweed planting with Otay Valley Regional Park. And I would see Breny talking with the mother and the daughter sometimes, engaging with the rest of the youth participants and having those direct conversations with them, just getting to know each other. We're out on a Saturday planting trees, and having that conversation, that genuine conversation, and then directly sending them an invitation, whether through phone or through email, sending them an invitation to future events, an individual customized invitation for them. I feel like that's also a good way to keep them engaged, to let them know that we care about them and that we remember them.
Thank you, Iridian. All right, so we are at the 11 o'clock hour, and so I just want to thank our presenters, Breny, Flor, and Iridian once again, and to all of our attendees for joining. You guys have our contact information, so if there's anything else, any questions you might have, please feel free to reach out, and we will be sure to answer those. And again, we'll be sending a recording and a link to the presentation that they put together later today. So thank you all, and we appreciate you.